Thank you, Mr. Speaker. Yesterday we heard that recent cuts to sexual health centres meant these clinics will no longer provide low-cost birth control to women who desperately need it. Now, whether this is, as AHS suggests, just a review, or whether it's a budget cut is actually irrelevant. What is important is that at-risk women in Alberta now have less access to affordable birth control than they did before. So to the Associate Minister of Health and Wellness, why isn't this issue a priority for you?
Honourable Minister.
Well, thank you, Mr. Speaker. And I'm aware of the issue that the College of Physicians have, of pharmacists have raised this issues with AHS, and together they're working out a solution. But I can guarantee you that those in most need of these drugs are continuing to receive them.
Honourable Member.
Well, Mr. Speaker, that's not what we're hearing from the centre. So given that research clearly demonstrates greater access to sexual health education and contraceptive methods is a fundamental pillar to long-term poverty reduction, and given that this was a program to lower barriers for women to obtain contraceptives, can the Associate Minister tell us why this government isn't taking action to improve access to sexual health services for low-income Albertans rather than standing by while AHS cuts it?
Honourable Member.
Mr. Speaker, the member infers that this is a budget issue. It's not a budget issue. This is a simple issue of the pharmacists have an issue with the AHS and the way this program is administered. It will be worked out. Albertans are protected. The minister is committed to this program and will continue to be.
Honourable Member.
Well, Mr. Speaker, given that we've been given no assurances around timelines for when it will be, quote, worked out, and given that appropriate and convenient access to birth control is the single best way to ensure women don't have unwanted pregnancies, and given that the lost service will hurt women across the province, will this government take responsibility and direct today AHS to reverse the decision to cut off thousands of women from low-cost birth control?
Mr. Speaker, again, I want to correct the member. The College of Pharmacists have raised an issue of the selling of these drugs. AHS is currently working on this issue to resolve this as quickly as possible, and the minister and the ministry is committed to this program.